Hi, let's talk a little bit today about what is appropriate to bring into your psychotherapy session, and if the client has concerns that they want to bring up with the therapist, is that appropriate? And the answer to that is yes. It is your session. You are paying this professional to provide treatment for you. So, for example, if there are certain things that you want to shy away from talking about in therapy, tell your therapist that. Or maybe there's a day that you're going in for session and there's certain things that you would want to focus on because that is a priority for you in your life at that time. Yes, bring it up with your therapist. They can't read your mind. And again, they work for you. And what about if there are concerns that the client has about their therapist? Maybe they feel not supported in certain ways, or maybe they felt offended by something that the therapist said. I would encourage you to gently bring it up with your therapist. Express your concerns and how it made you feel. And that is part of the psychotherapy. It is a relationship with your therapist. It is intimate. And we would expect as therapists that there are certain things that the client, maybe they have a different perspective on a topic, or maybe they misinterpreted something that was said by the therapist, and maybe it hurt your feelings or offended you. It's rare, but it does happen. So yes, I absolutely encourage you to bring it up with your therapist so that you can iron out any anything that's bothering you there, because if there's a rupture in a therapy, that's problematic. And it is the therapist's job to iron out any fires, so to speak, and repair that relationship so that you can move forward. Some other things that come up is I think that when potential clients are looking for a therapist, therapists are not a one size fits all. For example, especially therapists who are in private practice, we are trained in modalities that we want to get trained in. So every therapist is trained in different modalities, and there are hundreds of modalities. For example, I'm just going to ramble off a bunch, and some you may have heard of, and some you have not. So no particular order: narrative therapy, CBT, DBT, emotion focused, strength based, humanistic, motivational interviewing, ego state therapy, internal family systems, EMDR, psychoanalysis, psychodynamic, sand tray, sand play, emotion focused, solution focused, imago, if I'm saying that right, couples therapy, trauma informed care, art therapy, hypnotherapy, which is basically hypnosis. So that's maybe 20 or 30 right off the top of my head. And I realize that a lot of clients don't know what those individual modalities mean. A lot of people don't know what hypnotherapy is, or sand tray therapy. So I would recommend that you do your research, figure out what mental health symptoms are you struggling with. Is it anxiety? Is it OCD? Is it trauma? And then do a little research online to see what treatment modalities would be best for those symptoms that you're experiencing, because it is not a one size fits all. In fact, I advertise myself as a trauma informed therapist, and I do I'm what we refer to as eclectic, meaning I do a little bit of this, a little bit of that. There are about 6 or 7 modalities that I'm trained in. So if a client's coming to me, for example, because they have OCD, or if I'm working with a client, and it is within my scope of practice for the issues they're presenting with, but over time I start to see that there are some other clinical areas like eating disorders or OCD that I'm not trained in, I have an ethical obligation to refer that person out for those specific issues. And sometimes they'll continue working with me for what we were working on. But it is unethical for us to practice outside of our scope of practice. Um, so we will refer out. Okay, so I hope this video was interesting. Drop me a comment, leave me your feedback, and subscribe if you would like to see more videos.